Hi, I'm Dr. Delaney, and today we're going to talk about upper face rejuvenation. Like the rest of the face, the forehead and brows descend over time as the skin in this area thins out and loses its elasticity. We often see these kind of changes beginning in the 30s and 40s. While brow ptosis may not be as noticeable at first, like you would see with jowls, we do notice that the eyebrows come down and then we have more hooding that comes along with it on the sides of the eyes. Browtosis can make someone appear tired, sad, or concerned even when they do not feel so, and most people notice the hooding. Some other findings include more active, prominent horizontal wrinkles in the forehead, and this is because of the muscles lifting the eyebrows working overtime to try to keep the brows up and away from the eyes so you don't obstruct the vision. When looking at the eyebrows, we oftentimes use the rim of the eye socket as a reference. The ideal position in females is about a centimeter above the rim, where the arch is about a third from the lateralmost aspect of the brows. And then for guys, we ideally have the brows at the level of the rim and with a straighter configuration. It's really important when looking at the upper eyes or upper eyelids to look at both the position of the brows as well as excess upper eyelid skin. You may have one or both, and it's important to identify and treat both if that's what you have. If you have brow ptosis and extra upper eyelid skin, and you only remove upper eyelid skin with the upper blepharoplasty, the ending results will be better still, but won't be quite as dramatic as if you were to address both problems with upper eyelid surgery and a brow lift. A common mistake we see is that doctors end up going back for more and more upper eyelid skin removal without really recognizing that there's brow ptosis, and then the upper eyelid skin gets shorter and shorter. Sometimes you may not even be able to close your eyelids fully, so much skin has been removed. To surgically treat brow ptosis, we have two major categories of surgery. One is an endoscopic browlift. This procedure uses 5 incisions that are hidden in the hairline and an endoscope. So the endoscope goes under the skin and lets us visualize the forehead structures under the skin, which is why we could use smaller and fewer incisions. With this procedure, it's best suited for individuals who do not have a significant curvature of their forehead, so flatter foreheads, and in individuals who have a short or normal hairline, because it does raise your hairline slightly. Conversely, for those who don't meet those requirements, there's another approach called the Trichophytic forehead lift. And then, so in this case, an incision is placed along the hairline in an irregular fashion and beveled in such a way to allow the hair to grow back through the scar to camouflage the scar. So with the Trichophytic approach, we can approach down here where we need to lift the brows, even in a significantly curved forehead. And you have the added benefit of being able to also perform a forehead reduction at the same time. When looking at the upper face and the eyelids, the brow position is of critical importance and is something that is oftentimes overlooked. We have many patients who come in and say they want upper eyelid surgery or upper face rejuvenation without realizing that maybe they actually would need a brow lift at the same time. A brow lift is oftentimes performed in conjunction with an upper eyelid surgery, where we would perform the brow lift first, correct the descent of the brows, and then take out upper eyelid skin. And then usually in these cases, we end up taking out less upper eyelid skin because the problem is a combination of brow ptosis and upper eyelid skin excess and not just upper eyelid skin excess. And then also we oftentimes would perform brow lifts in conjunction with facelifts. So a brow lift addresses the upper third of the face and a facelift addresses the lower face and the neck. And so for facial rejuvenation, oftentimes these are performed at the same time to provide our patients with a more refreshed look. I hope you found this video informative, and we look forward to seeing you at Facial Plastic Surgery Associates.